Is Robert Kim-Farley. He is a professor at UCLA's Fielding School of Public Health. Thank you so much for joining us.
It's my pleasure.
So the CDC is warning Americans it's not a question of if coronavirus spreads across the United States, but rather when. President Trump insists the problem will disappear very soon, but US and global markets, well, they appear to believe the health experts rather than Trump. What happens when the public get mixed signals like this, mixed messages?
Well, I think it is important that there be a consistent message that is given to the public so that there isn't a misunderstanding. I think the important thing is to recognize that the CDC is really trying to say that we need to be preparing for the worst, but we are hoping still for the best.
Right, and of course, the CDC tweeted Tuesday evening that Americans should think about getting ready for an outbreak across the country. So what does that mean exactly? What should we all be doing to prepare for a novel coronavirus outbreak? What should businesses be doing? What should individuals be doing?
Well, I think first, a couple of things to think about is to what is the scenarios that we might expect. You know, the one scenario would be like with SARS that happened, that ultimately the genie, if you will, was put back into the bottle within about 9 months period from 2002 to 2003. I don't think we're at that stage with current coronavirus. It's really out of the bag at this stage. We can also think, I see a scenario of fits and starts whereby it's like throwing matches into a forest fire. It may start in different places, and that's what we're going to be seeing potentially in other countries, like we've seen already in Korea or Italy. But the real concern would be like in a densely populated developing country, let's say Lagos, Nigeria. You could have a much more explosive outbreak there. But we can have the third scenario where basically you end up with the fact that this becomes a virus that does spread pandemically around the world, including here in the United States. And we'll have to learn to live with it, if you will, like we do with influenza. We have to realize influenza kills 36,000 people a year here in the United States. And hopefully we'll be able to mitigate over time with vaccines that are under development. It will still take time for such vaccines, of course, to be able to be tested in humans and to be able to come up to speed in terms of development to scale where it can be helpful.
Right, and it's worth pointing out that Singapore appears to have learned from the 2003 SARS outbreak and has successfully contained the coronavirus. Why aren't other countries following their lead, and what are they doing that all of these other countries need to be doing right now?
I think one of the things that happens, and we call it non-pharmaceutical interventions, or NPI for short, the idea that if we don't have a vaccine, what are the other things we can do? And that can be done at personal level, where you have, for example, social distancing, people making sure that if they are sick, they're not going out, that we are making sure that we are washing our hands frequently, covering our cough and sneezes. Those sorts of things can be done at the personal level. At the social level, community level, social distancing can involve the issue of closure of schools. It can involve closure of theaters, things like this, where you have large numbers of people congregating. So those are the two things that can exist, and that's what Singapore was doing in SARS. And certain cities will be having to do those same sorts of things if they have actually local community-based transmission. It's not where you have these small introductions occurring where we can contain it. We isolate the persons who are sick. We look at their close contacts and have them in a quarantine situation. But if you have community spread where you do not actually know where the sources now are coming from, that's when you have to practice some of these social distancing efforts. People telecommuting to work, if they can do that. Maybe there'd be even internet distance learning for students if there were school closures. These sorts of things. I think that's what the CDC is trying to say, is that we should be at least thinking about those issues now, businesses, schools, et cetera, so that they are prepared should this local transmission occur in selected areas in the United States even.
Some important tips there for all of us. Robert Kim-Farley, thank you so much for talking with us. I do appreciate it.
My pleasure.